Good morning, everybody on the call. We'll begin in just one moment. All right, let's get started. Welcome, everybody. I'm Marcy Caulfield. I'm the Family Readiness and Program Manager for the Vermont National Guard. And just to change it just slightly in the beginning, we're actually going to do the introductions, go around the room before we get started on our topic today, which is prevention. So my lovely assistant here, Kim, will grab the item and
Hi, I'm Dan McInerney. I am a family program specialist.
Hi, I'm Tammy Langlois. I'm the Airman and Family Readiness Specialist at the Vermont Air National Guard.
I'm Jeremiah Paquette. I am the Media Specialist.
Hi, I'm Eric Stufford. I'm a chaplain.
Hi, I'm Nikki Sorrell. I'm the Program Manager for the Sexual Assault Response Prevention Program. I'm Rachel Schneider. I'm the Sapper Specialist.
I'm Serena Fernari. I am the Wing Sark.
I am Maura LeMay. I'm for Kevin.
I'm Jessie Smith. I'm the state SFRG, Jim, your fingers in the way, and I work for family programs.
I am Colin O'Reilly, Survivor Outreach Services Coordinator.
Hello, I'm Charlene Cayano, Vermont Veterans Mental Health Counselor. Megan Sadler, Personal Financial Counselor.
Andre Wayne. Andre Daigle. Rick. Andre Wayne, Program Manager, Vermont Veterans Outreach. Happy to be here.
Vermont Veterans Outreach, Addison County.
Chris Boutin, Integrated Primary Prevention Workforce Lead.
Exactly.
I'm Kylie Clancy. I'm a Tactical Specialist with the Integrated Primary Prevention Workforce.
Victoria Silsby, Prevention Specialist with the Collaborative. We're nonprofit.
Good morning. I'm Alice Abraham with the Collaborative, and I'm a projects manager.
And now we'll go to those on the phone before ending with Miriam. Who's on the line today?
This is
I'm
Jake
Larry
Wolf,
Forsythe,
Veteran Outreach.
Vermont Department of Labor. I'm the local Veterans Employment Representative.
Good morning, Larry. Welcome.
Thank you.
Jake Wolf, Veteran Outreach, Orleans, Caledonia, and Essex County.
Hello, Jake.
Hi, my name is Tasha. Hi, my name is Tasha Lovelace. I'm calling from the Albany Recruiting Battalion. I'm the Soldier and Family Program Manager.
Good morning, Tasha.
Good morning.
This is Sal Yargici from Veterans Outreach. I'm here with Steve Hernandez.
Good morning, Phil and Steve.
You hear that? Andre and Steve are sharing a computer, basically.
Yes, they are. And who's talking now?
We have Rob Dornfried, Yellow Ribbon Program Coordinator.
Good morning, Rob. Lucas, was that you? Lucas Lordich, was that you speaking?
No, but I am now. Lucas Lodick, Southeast Vermont Veterans Outreach, covering Wyndham and parts of Windsor.
Good morning. Anyone else?
Lisa
Thomas Runner.
Good morning, Lisa.
Thomas Runner from the Office of Congresswoman Becca Ballant.
Good morning, Thomas. Anybody else on the call?
Hey, Marcy, it's Richard Gallo from up in Rutland, Vermont. Vermont Veterans Outreach.
Good morning, Richard. All right. If you are not able to talk on the line, if you could put in the chat box your name and introduce yourself in the chat box, we'll grab it there for attendance.
I'm so sorry, we didn't get a chance to.
Hey, just walked in. I'm Brendan McCormick. I work for a substance use treatment facility called Summit. So we're recently in Edwards and Track here. So
Welcome.
for inviting me. Thank you.
Andre.
What?
No.
Oh, okay.
Are we good?
Yes.
Anyone else on the line? Want to cut anyone off?
Just so everyone knows in the room that the closed caption will capture side comments, and it may or may not be correct.
I can vouch for that, dealing with closed captioning for, well, too many decades. Welcome, everyone. Good morning. It's good to see everyone here and on the line, in here, out there, everywhere. So thank you for being a part of our meeting. As Marcy has sent out the agenda, today's topic is prevention. And I think of prevention also as preparation. Preparation for the unexpected. We know that we can't really predict what may or may not happen, but it's important to try to build strong foundations. And sometimes it means even rebuilding strong foundations, depending on what's going on in our lives. I also think it's circular rather than a straight line for prevention. Like most things, like grief, for example, it's not a straight line. Grief is circular. I think prevention is the same way. It's interesting that we are doing this topic this week, because this week is the 5th anniversary of COVID. Talk about trying to prepare for something that's unexpected. So I think that I know for myself, I have done a lot of reflection on what has happened since and how it has changed everything. All we can do is try to get in front of things to see if we can manage them, reach out to others, and be sure to know that you're not alone. So with that, I am going to turn it over to our first presenter. Right? Oh, bathrooms and such. Out the door to the right is the men's and the women's room. And there's a couple of more bathrooms down the hallway through the drill hall floor. Hi, Kylie. Hi. Hey, so we are lucky with the Vermont National Guard. We have part of our J9 division is the Integrated Primary Prevention Workforce. And Kylie is here to talk about what we do here at the Vermont National Guard.
Hi, everyone. Good morning. Chris is also here. Hi, Chris. We're part of the Integrated Primary Prevention Workforce. Do I tell you guys to change slides? Great, change slide. A breakdown of our team. So Dr. Stevenson, Debbie Stevenson is our IPPM, our manager. Devin is our prevention lead with Chris. And then Matt, who's over on the wing side, and I are the tactical prevention specialists. So to give a little bit about our history, why we came to be, in June of 2020 was the murder of Vanessa Guion down in Fort Hood, Texas. At that time, there was true crime podcasts that were like shining a lot of light on the military, right? And the public was really trying to understand how did this happen? What were the indicators? Were there missed signs? And so with that, the defense secretary decided to launch an investigation to figure out what was happening, and what they came to find was that there was indicators all along. Her peers were aware of some of these indicators, but that leadership had missed some critical marks. And there was maybe an opportunity for some sort of intervention, and it didn't happen. And unfortunately, she lost her life to that, and others were impacted as well, just from the residual trauma of the experience. So with that, they also started to look at what is the military doing to get left of the problem of interpersonal violence. They found that we put a lot of money and resources into response, which is great and really important, but we weren't doing anything for prevention. So that's how the integrated primary prevention workforce came to be. And we first showed up in Vermont in 2023. So we're still pretty new and just sort of laying the foundations. Go next. So the idea of primary prevention is about stopping something before it happens. So being as early in the intervention phase as possible. Secondary prevention is like the immediate response to violence when it happens. And then the tertiary prevention is a long-term response to violence and support in the community. So our work is, yes, working with people, but also trying to explore ways to implement research-based prevention activities that will hopefully show over a long period of time a reduction in trends of interpersonal violence. So these are the domains of violence that we focus on. It's integrated, so we don't just focus on one. We look at all 4 of these, and they have shared risk and protective factors, which Chris is going to talk about. But we focus on sexual assault and harassment, domestic violence, workplace violence and harassment, and then suicide and self-harm.
Excellent. Yeah, so as Kylie mentioned, like where the integrated part is focusing on the shared risk and protective factors for each one and creating a plan that incorporates all of them. So here are the shared risk factors that we've found. We have harmful cultural norms that support aggression towards others, harmful norms around masculinity or femininity, and accepting of substance misuse. So just a lot of drinking culture within the military. There's high levels of stress and interpersonal conflict, unresolved mental health issues. You know, there's because of stigma, not wanting to get help with fear of losing your position or not being considered non-deployable, or a lack of non-violent problem-solving skills. So these can perpetuate violence within the work, but also be brought home. And then we turn into like some domestic violence issues. The green shows our protective factors. Protective factors are characteristics that lower the likelihood of negative outcomes. So you have connection or commitment to the group, skills in solving problems non-violently, positive conditions for the and then you have like access to healthcare, economic stability, education access, and neighborhoods. And then it's our job to reduce risk factors and bolster the protective factors. So we go through and through assessments, we're able to identify what our high risk factors are within our units. We're gonna skip past this. Debbie made this slide. I'm not really sure where she was going with that. So within these 4 domains of harm, we have our collaborators that we're working with. So the sexual assault and harassment, we have the SAPR folks. They're the subject matter experts. Domestic violence falls underneath family advocacy. Workplace falls under equal opportunity, and self-harm and substance misuse is with SARC and chaplaincy and behavioral health. Next slide, please. So we fall under RAP. This is everybody together. This stands for wellness, readiness, and prevention. The intent of this directorate is that when a soldier, airman, or family member comes to us for support, there's no wrong door. So anybody they come to for help, we can initially sit there and chat with them, and then we can figure out where we need to bring them to get the support that they need.
keep going.
So,
There's a lot of them, right? A lot of different
Yeah.
participants in that.
So some of you may be familiar with the public health approach to prevention. And you've seen this framework or ones that are similar to it. For years, our various departments have conducted their own analysis on the factors before. So you have seen the DEOX, R3SP, the URI, G1's exit surveys, and the training and retention surveys. But Vermont's never really had the capacity to bring all that data together and put it together into one document and present that. So that's what we do as the IPPW, is to gather all the information and try to chat with commanders and help them build a plan to move forward. Next slide, please. So this is our process. So in order to know what needs to happen, we have to understand the problem before we can fix it. So we start the data collection. From there, we created the SIP, the Comprehensive Integrated Prevention Plan, with our goals. Then we implement our research, the informed practices to reach our goals, and then we continue with program evaluation to ensure that our practices are working. Next slide, please. So in 2023, these are the needs assessments that we've conducted. So we've had our ASAP, PO, and SEPR incident rates, the 2019 organizational assessment, our legislative reports, or the critical incident reports, and the status of discipline. That's all come out from this information here. In 2024, we continued for the information that we had in 23, and we chose to focus on some of the gaps. We were missing a lot from the airwing side. We were very Army focused in 2023, so we did more work to try to include information from the air so we can help them as well. Next slide, please. So these are the 6 biggest risk factors that we found. Exposure to violent stress, social isolation, interpersonal conflict, lack of support, and low connection to the commitment of the group. Here's a socio-ecological model of prevention. So we have the individual level, so providing information and support for the individuals, interpersonal is at home. When we get to like the service, and that's the 06 level.
That is
the community.
That's community, right? And then state is like the broader, large.
So a lot of our partners, they focus on the individual and interpersonal. We review a lot of policy with our data analysis and make suggestions where changes should be made to incorporate prevention. Next slide, please. So after analyzing the data, we came up with an overarching goal to address the known problem areas with the intention of reducing risk factors and increasing protective factors. These don't operate independently of each other. They're interconnected like a spider web. For example, by increasing community collaboration, we can also increase access to resources, which in turn reduces stress. So we can develop leadership, we can improve interpersonal communication as well as reduce stress. Next slide. So this year's SIP, these are 3 lines of efforts. This is what we presented to the tag, what we wanted to focus on this year. It looks like a pretty in-depth list, but one thing we wanted to point out, the 2 pieces that are starred are the only ones that aren't currently already in the process of being worked on. So we're just collecting data and following the rest of them to show what's happening and ensuring that we continue on with that work.
Yeah, any questions? Love it.
For those who are unaware, when they said tag, it's the adjutant general that's provided this information, and it's the primary focus is on the military community as a target audience. Any questions on the line in the room? All right, the next presentation that we have is Alice and Victoria, please. And they're going to educate us on the upstream prevention.
Yeah, I'm wondering how much repetition we'll have. You saved us like 5 minutes. Oh, good. That's good to hear.
Kylie and Chris, I want to thank you because you basically were a plan for us. We weren't really sure the level of understanding in this group of prevention. So with your introduction and Kylie and Chris's, we're pretty confident. I also want to give a shout out. I think I heard someone online representing Becca Balance office, and Alice and I weren't there, but a month ago, 2 of our co-workers met with you on Capitol Hill Day through CADCA. I think, Tom, are you from Becca Balance office? So that's a nice connection, right? You met us at our organization in February, and now we get to meet you online.
We'll introduce ourselves. We're from the Collaborative, which is a nonprofit substance misuse prevention coalition located in Londonderry, but we serve the whole lower half of Vermont with services, and also we serve statewide too. You'll hear more on that. I'm Alice Abraham, and this is
Victoria Silsby. I'm the prevention specialist with the organization. When you hear the word prevention, thanks to the introduction and also to Kylie and Chris, what are some of your thoughts already on what does prevention mean? Substance prevention, what do you think of? Don't be shy. Protective factors?
Education.
Education.
Support.
Support. All right, I think we're going to touch on those 3 at least, and if you might be sitting here thinking that there might be other things. So my dad, he was a 30-year plus smoker. He was born in the mid-20s. He was served in World War II, and he developed his nicotine addiction. Thankfully, I didn't know him when he smoked, but in large part due to his service in the military. And that's a big swing, pendulum swing from World War II to where the military is now on the culture, and also listening to tobacco companies' influences. Today, if he was in the military, probably wouldn't have been a nicotine addict. In World War II, the tobacco companies gave service people cigarettes for free because they needed to create users in order to line their profits. Alice, do you want to?
So fast forward, next slide, please. What's this about? All these colors, flavors, etc. Anybody heard about flavored vapes? Okay, so back in 2015, the youth smoking had almost been wiped out. It was greatly decreased. Well, that's not going to work for the tobacco companies. So that's about when they introduced vapes. and to be more specific, to target it to the children, and get them hooked even as young as second and third grade, we've seen in Vermont, for example, to get them hooked through the flavors. And also menthol flavors to target people of color and the LGBT community too. So they've used the old handbook of getting people pulled in, quickly addicted to flavors and vaping, and that's, people say, well, it's a substitute or a way to get off cigarettes. Not at all, but let's go on with
The next slide, please.
Yep.
So what is prevention? So the collaborative about 5 years ago realized that our counterparts, other coalitions throughout the state and the Vermont Department of Health itself didn't really have a unified definition of prevention. And within our organization, even among us, we were struggling to have a unified definition. So for us, it comes down to providing people, businesses, schools, municipalities, stakeholders such as the military, with the tools, the spaces, the partnerships, and education to make the healthy choice the easy choice. We're not prohibitionists, okay? But to also recognize the risks and consequences of using substances. So Chris and Kylie brought up alcohol use. Some people can have a drink and walk away, and others can't. I think we have recovery in the house today. So what does it mean to make the healthy choice the easy choice within the recognition of what's safe and not doing you harm?
So what does the collaborative do? Well, looking at these different pictures, we've got a MedSafe box. Actually, you want to explain the history?
So Clinton County, first county about 14 years ago to enact safe disposal. And the state looked at our model and liked it so much that they replicated it across the state. So pretty much in every county, in multiple towns within each county, there are avenues to safely and properly dispose.
So
RX meds that keeps it out of the unintended user, right? When you're done with the script, there's usually a few pills left over. Get it out of your house. There's also a mail back envelope system through the state. So if you can't get to a kiosk, you can always mail it back free, anonymously. And again, it's getting it out of the house so that an unintended user, a non-prescribed user, doesn't have access to that medicine.
And so family members don't share medications that weren't prescribed for them, or they're expired and ineffective, so why keep them? Any number of things. But so you might think of MedSafe kiosks such as that in police stations, and they are anonymous, et cetera, to use. But the collaborative worked very hard to be the go-tos and the authority on how to set up a system for hospitals, for pharmacies, and that's a lot easier for the public to use. And so, yeah.
That building in the background of this slide, does anyone recognize it?
That's Bennington.
It's our armory. That is our armory your armory in Bennington, and I say ours because we had the fortunate experience a few years ago, working with a community partner, that the armory let us host an event there.
So back in 2023, it was summertime, storm clouds were gathering that weekend, and it was also Bennington Pride Festival. The collaborative suggested, you need a nice place that's large enough in Bennington. Have you talked to the National Guard? The organizers for the festival were frankly reluctant at first. They didn't know what kind of response they would get. It was very welcoming. And to even add on to that, there was smoke-free signage already installed outside the perimeter, which was exactly what our messaging is. So we had a great festival there. Since then, a lot of community partnerships were established.
One of the things that people think signage, that's, well, of course you can't smoke here, right? Or you shouldn't smoke in a park, or you shouldn't smoke on a hospital ground. But the science behind, and Kylie and Chris spoke to best practices, so the science behind signage is if you're decreasing access to spaces, and we're not just focused on tobacco, but if you're decreasing access to using, then you're limiting the person's spaces to use, and the more places where someone can't use, they're finally going to say, wait a minute, if I can't smoke here, and I can't smoke here, and I can't smoke here, might as well just give up. The same can be talked about with buffer zones when you have a convenience store right next to a school and all that advertising. The town has the power to create buffer zones and push that convenience store maybe 1,000 feet, maybe 1,500 feet away from the school. And it's the same sentiment as signage, as creating buffer zones is a prevention.
So again, with the signage, you can see there's different variations. Can we go back for home? Okay. The one on the far right here also includes alcohol, vaping, along with cigarettes, nicotine use, and cannabis. And nowadays, you can keep adding to an endless list because there's also sins. Does anybody know what sins are?
Caffeine.
The pouches.
The pouches. Do you only put it in your mouth?
You're supposed to only put it in your mouth.
Well,
I don't know if you're on Instagram.
We might want to leave it at that. But yes, you can get caffeine pouches, so whoever said caffeine pouches, nicotine pouches, you can vape alcohol. And it's these, and it's
cannabis.
Vape cannabis, even
There's
though it's
so many things.
federally, it's still federally illegal.
Yeah. Just quickly to note, we're now running in finding athletes are using ZINs discreetly by cutting between their toes and putting the pouch in there so they aren't using, and it goes right into their bloodstream with way too high a dosage of nicotine.
And the thought is from the nicotine companies is that nicotine is a performance enhancing substance.
So it's all back to marketing.
And the nicotine companies are saying, wait, you're an athlete. Here's a way, use nicotine to increase your performance.
Next slide now.
Oop, that's two.
Yeah.
Where I've lost my place.
Components.
Right here. Okay, so now we've given the examples of what prevention is, but now we're gonna feed off of Kylie and Chris and talk about components of prevention. And really, you can't talk about prevention without talking about social determinants of health, which Kylie and Chris also brought up with their focus of preventing violence. So social determinants of health, those are like our basic needs. Do we have housing? Does someone have a stable job? Does someone have access to food? Does someone have, I think someone mentioned education when we opened the conversation. So those are all social determinants of health. So when one of those components are weakened or don't exist in someone's life, there's also the tendency, the risk factor.
Did you say transportation to services?
Transportation is a determinant of health. If someone can't get to their doctor's appointment. Or to school.
Need to sort of cover, checklist the basics and make no assumptions. In other words. Next slide. So this parallels one of your slides there. So we can probably move on past this, but I just wanted to acknowledge we're on the same page. Okay, go on. And this parallels your triple waterfall. This is our version of the upstream river.
So we've talked about the continuum of care, prevention, treatment, recovery, and then it being not on a line. I think someone said not on a line, but in a circle, and that's really important. So prevention is on that river at every component. Downstream, we're right there with treatment and recovery, helping people get out of the river, supporting people once they get out of the river. Midstream, we're talking about, maybe you shouldn't go over the waterfall. Maybe we're gonna help you not go over that waterfall. But while all that's happening and those conversations are happening, a group of us, not every preventionist, but a group of us are above the bridge going, why are all these people falling into the river to begin with? And what can we do to stop people from falling into the river? It's important to get people out of the river. It's important to help people not go over the waterfall, but it's also important for some of us to really focus on those social determinants of health and protective factors and to reduce the risks of harm.
We might also want to inspect the bridge to make sure there's no holes or anything there to fall through. Next one. So this is a pair of campaigns that we're running now. This slide in the next. This is parental social norms.
What we mean by social norms is, Chris and Kylie spoke to data. And so when we're looking at data, yes, we're looking at what's the percent of people that are identifying as, with 30-day use of a substance. But we're also saying, wait a minute, when we're looking at those numbers, it might be that 24 high school students across Vermont report vaping. But then we're also able to say 76% of Vermont high school students are not vaping. Let's accentuate the positive so that the people that are involved in substance use can say, wait a minute, I want to be part of what everyone else is doing. Maybe I should quit. Maybe I should cut back. And so that social norms focuses on promoting the positive in a community or within a group.
So with this slide, we call it parental norms, but really it should be caring adult norms, but that's a mouthful. And why do we want to say caring adults? Because in this day and age, frankly, it might be grandparents, it may be a foster parent, or somebody else that's not biologically related. That's the caring adult for the youth. So again, this is listening, connecting with other caring adults. What works? What doesn't work? So the two messages, this and the next campaign, through focus groups, listening sessions, caring adults across Bennington County shared their desire to learn how caring adults, neighbors, and other school families created shared ideas, etc.
So they wanted to look at what's my neighbor doing to help support their kids and make healthy choices. What am I doing? So again, it's addressing that isolation that sometimes caring adults feel like I'm the only one with a kid in high school and I've got to help keep them on the right track, right? So encouraging parents to talk to each other and learn from each other, that's what this campaign is all about.
So the next slide is young adults. And by that, we are looking at the age group of 19 through 26. And a couple of data points. It's important to have appropriate discussions early, and which help delay the age of starting to use whatever substances, or maybe choosing not to use any substances. So a couple of points, and the slides will be available afterwards, but 90% of adults struggling with addiction started before age 21. 90%. Next one, 1 in 25 risk addiction if they drink or misuse substances, again, before age 21. So that's 1 in 25. And finally, 1 in 4 risk addiction of drink or misuse substances before age 18. So it's never too early. And think how we talk to young kids about stranger danger or anything else, or how to get.
You have to wear your helmet if you're going on a bike. Yes, you have to wear your helmet if you're snowboarding, right? I always joked my kids would forget their skis, but they wouldn't forget their helmet.
So again, you know, this is just another, there are strategies to make it simple, positive tone, etc. And a discussion, not lecturing. So that's all part of this. Younger ages and also during the young adult transition time too. Want to say anything more on, or should we move on? So now for a couple of graphs. So this graph is, as you can see, we've got different demographics at the bottom, all color coded for years 19, 21, and 23. So this is the most recent data for percent of Vermont high school students who feel, quote, they mattered in their community. So self-worth.
And I think, again, Kristen Kylie talked about that component of loneliness, feeling alone. This is what this data is referring to. And also, you're probably thinking, well, this is high school, but I don't serve high school, right? High school kids aren't necessarily in the military. But this, if they enter the military feeling unattached or not mattering or alone, that's a risk factor. So what's going to happen when they get involved with the National Guard or the family military?
So going from left to right, any parallel or similar
so the pale blue is 2019. The darker blue is 21, and the green is 23. The far right bar So this bar, this means white, non-Hispanic.
Any notices? Yeah.
It always makes me wonder if the dark blue is because of color.
Yeah,
Yes,
and that's a really good point because the data from COVID, students usually take this at the spring of every 2 years at school. And there were very few kids at school, springtime, late winter, for 2023. So you make a good point. But it's still the blue line, yes, there's a 6-point difference for the overall in Vermont, right? But it's still remarkable. It's still in the 50s. So that means about the other half, the other 40% of students in Vermont.
So the source for this information is the Vermont YRBS, which is Youth Risk Behavioral Survey, done every 2 years. And yeah.
Sorry, I had a question online. Sorry.
Yeah, what's the question?
Oh, so the question online, somebody wanted to re-clarify why this data was being collected.
So this is actually a national survey of young people in middle school and high school across the country. It's organized through the CDC. Again, it's offered every 2 years. Parents can opt out if they don't want their student to participate.
And this is probably also our most vulnerable population.
Any high school student would have participated in Vermont, would have participated unless their parent explicitly told the school they didn't want their student participating in it.
But actually why this data has been collected, because this represents one of our most vulnerable populations to addiction, to nicotine.
Yes, and to help us.
Yeah, you can cross-tabulate this, so you could take the data from this and I forget what the technical word is, so sorry for any data analysts in the room, but you could cross-tabulate it with the 30-day use and see if there's any stories behind that data. Did that answer your question?
Next slide. Okay, this the source for this one is Vermont YAS, which is Young Adult Survey, spanning the years 2020 and 24. And yes, in this case, the impact of COVID offset what was collected. So again, we couldn't do a direct matchup from the other reporting survey to this one. This was the closest that we could align the two. Again, the same categories at the bottom.
There's more to this.
And the third slide is
these are adults that are reporting.
So this is the BRFS. BRFS stands for let's see, Behavioral Risk Factor Surveillance System. Another mouthful. And this only collected, the closest we could get was the catchphrase. They always or usually feel socially isolated. So in terms of loneliness or having suicidal ideology, a number of things could fit in under this, but yes.
Sorry. Do you think that the fact that Vermont is actually considered the most rural state in the country at just under 65% rural, for number one, do you think that might play a part?
It could. And again, think of those social determinants of health, right? And the ability to access resources and how willing people are to say, wait, I need help. So if you if you've lost your car for whatever reason and you're 10 miles out of town, how are you going to get
public transportation.
and you live on a dirt road, I'm guessing the public transportation doesn't go past your house on the dirt road. Or we're really good in Vermont about north-south, south-north transportation services, but we're not so great about east-west transportation.
Next slide.
Thank you.
Okay, so the collaborative, again, always works with its partner coalitions throughout the state, and there's a huge network. But in the past year, there's also a major reorganization. Now look at this gray blue area, which spans 3.5 counties. The collaborative represents that, and as the coordinating coalition now, working with everybody else in the health districts and many local and statewide partners. In addition, you want to explain tobacco control?
Sure. So we also receive, like many of our sister coalitions across the state, tobacco prevention and cessation funding. And it's specific to Bennington County for much of the grant funds, but except for 2 components. And that would be identifying policy language and support on smoke-free areas. So it could be smoke-free parks, it could be smoke-free town greens, anything like that.
It could be outdoor spaces, short-term or long-term.
Yeah, could be events. And then we're also the designated lead on vape disposal. We're working closely with ANR, Agency of Natural Resources. This summer, ANR will roll out new
ANR being Agency of Natural Resources.
New procedures on how to dispose of vapes, and it's going to come under household waste,
which will be quite a switch.
But yes, we came all the way up here. It was a beautiful 2-hour drive for us this morning, but there are coalitions across the state. So Healthy Lamoille is down the street from here. There's a coalition in Burlington. There's a coalition that serves the St. J area, the Rutland area. We have a sister coalition in Bennington. So we're all over the place. We like to have said, yes, we've taken over the state, but we haven't quite yet. We couldn't do the work without you, our partners, and also coalitions across the state.
I was just curious, do you take part in the addiction summit that happens every year?
Sometimes the one up at the fairgrounds.
Yeah.
I don't think any of us have done that, but what I am gonna do with your permission is when we get back to the office, there are a couple statewide conferences that are coming up. One is very specific to school-based prevention, and one is the health department is putting it on prevention, and I think that one's May 20th, 21st, something like that. And I'm gonna make sure that you can share that information out and invite everyone here to attend.
And before we go to the next slide, I also want to under tobacco, and it's not prevention of tobacco, it's all thanks. We have much more to quickly touch on, but we're also by Vermont Department of Health appointed us as state lead for secondhand smoke. Does anybody know what that means? What is it?
When you're in the car and your parents are smoking.
Yep. So secondhand smoke is being in proximity, inside, outside, in a vehicle, at home, with another person who's actively vaping or smoking. Anybody know what third-hand smoke is or vaping? Anybody? Yeah.
Smoke gets into materials like pages of books or clothes or carpet.
So think of if you're smoking at home and your kids
And vaping.
and everybody else is at work, at school, doing drills, whatever, you're still, for better word, choice of words, you're contaminating the home environment. All the fabrics and the books and materials, kitchen counter space is coated with the particles. And also children crawling or your pets coming in contact with the chlorine, of course, are then putting things in their mouth, or the dog may be licking up, I don't know, ice cream or something, along with all these chemicals. So that's what third-hand smoke is. But let's get on to what's really important. Next slide. So bringing it back in, what are your needs? How can we provide our expertise or our partners' expertise to assist military families and communities? So here's a sample. This is sort of like a showcase of a series I'm coordinating right now down in the town of Springfield. And it originally started with the librarian asking, can we just have a presenter? Oh no, they also called Department of Health. Do you know anybody that can do a presentation on vaping education cessation? Go to the collaborative. Okay, but now we have a lot more ideas for topics that are hot issues in our community. Grandparents bringing up kids, and these are some of the things that they need to deal with. So this is our whole series for the next rest of the year, actually, on that. And that's only a sampling of what we might be able to provide. We also have a staff epidemiologist too that helps us keep focused and on.
Look at our data.
Yes.
Prevention isn't just about telling people not to use, right? Some of us in the room might remember the DARE program, or our kids going through the DARE program. That no longer aligns with best practices. And so it goes back to how Chris and Kylie, sorry, and how we've talked about the protective factors and the risk factors. And that's really the groundwork of prevention. No more is it, this is your brain on drugs. I remember seeing those ads when I lived in Burlington in the early 80s. And I wondered how was it that my brain looked like a fried egg in a frying pan? It didn't make much sense to me, and it didn't speak to many of the young people in Burlington at the time. So focusing on those risk and protective factors, and in order to do that, it takes a community, and it takes every one of us in this room and outside of this room.
So these last few slides we'll run through very quickly. Actually, we don't even read through it that faster than we could say it. So those are the main points. Go to the next slide. Main factors. And again, the slides will be available. And yet more factors on the next slide.
Some of these risk and protective factors really overlap with the prevention work that's happening in this room.
Out on the resource table in the hallway, you'll see some stigma-free language braille cards that please take those. And next slide. And as Victoria was just starting to say no to just say no, and also to the DARE program, which was formerly used. And remember, there's no stigma to prevention, and it's usually not a solo effort, and it's rarely simple or easy. or if we've already been done?
We usually talk about it as a multi-pronged approach, right? So you need a program, you need education, and you need policy, which person you spoke to, right? So we're talking about substance prevention. They were talking about violence, thank you. I was thinking of assault, but I didn't want to say that word. So, but it's those three components: education, programming, and policy.
So thank you very much. You've got our contact info, website for any follow-up.
We can also follow up and send you coalition names that are throughout the whole state, which might help, since I'm guessing you guys are all from across the state.
Any questions at this time?
Have any additional questions? All right, thank you. This was really informative. So what I'm gonna do is just jumble around so we have some extra time. The agenda, and Jessie, if you wouldn't mind, thank you.
Brought a friend to help me with this. Jessie Smith, State Social and Family Readiness Group Leader, and I'm also a member of the Governor's Challenge team here in Vermont. Maura LeMay, Family Representative for the Air Guard, and I'm in charge of the Governor's Challenge. So what we just want to touch real quick, we don't need to spend too much time on it. This is our flyer, and they're also on the resource table. I made a bunch of copies. So this flyer talks about the interactive wellness map. So as part of Governor's Challenge, the purpose of that is suicide prevention for military and their families. So what we do is we basically just try to find different ways to figure out how we can prevent suicide for military family service members and the military. Okay. So with the Governor's Challenge, we have 3 priority area groups. One is about asking the question, community connection. The second is prevention, and that's when we came up with the interactive wellness map. And the third one is safe storage of medications and firearms. When we came up with the interactive map, it started in the very beginning, and the goal was to, okay, let's put some resources together onto a place that you can scan a QR code. As a family rep, I think lots of times, my 14-year-old son isn't gonna walk into my room and say, hey, I need help, what can you find me? But this gives a QR code for crisis agencies in different areas. It lists out clinicians that should be seen within 7 days of starting the first engagement. And then you can scan the QR code, and that will bring you to also insurances. Yeah, it's also, you can filter by different, you can look on the map in your area, you can filter. We made sure that the main insurance companies that military families use are actually locked at the top of the filter list, so you don't have to search through a ton. We do know that this is a work in progress, as just finding somebody for help isn't really the biggest challenge we have here in Vermont. The availability of those providers is also a big issue. So that will be a challenge that we'll have to address, because they may find a center that takes TRICARE, but is that center already oversaturated with TRICARE patients or just patients in general at this point? So we know there's still a lot of work, but this is at least one piece of the puzzle that gets people a little bit farther than they would have before, and it is very user-friendly. And this is going to be paired hopefully with Psych Armor, which is going to be a training pathway so that we can train and educate and communicate with
primary care providers and primary clinicians in the area that are on our database. This is a voluntary map. Everyone was contacted. It's voluntary to put on there, and then the hope is to have that education and training pathway so that these clinicians will be what we will consider vet ready or military ready.
Want to go to the map? So this is the map right here. And then you go through the advanced filter, there's how you walk-ins, urgent care, so all of those little bubbles. And then you can go down.
One of the nicer things too, as we talk about COVID and the last couple of things that we've talked about, is we do have ones that show that are in person, and we also do have ones that are online. We know with all the CCBHCs that are coming up, that online billing and resources, people are looking for more in person, or if there's individuals who are suffering co-occurring mental health diagnoses such as agoraphobia and do not want to come out of their households, we have an online list for them so they can still get the same quality of clinician services as needed.
Does anyone have any questions? And as I said, the flyers are out on the resource table that has a QR code. We're trying to get them out to our formation as much as possible, but that's us. Thank you.
Thank you.
For those on the line, when we send out the minutes, the flyer that you saw before with the QR code will also be included.
Hey, Mark, this is Richard from Rutland.
Yes, Richard.
I have a question. I didn't want to let them off the hook too early. I didn't get a chance to really respond, but in regards to the crisis, I mean, whether we're talking, the local emergency room or the VA in our case over in White River Junction, down here in Rutland, I don't know if they've touched base with the crisis response team that we have here. We tried to interject with one of our local veterans recently at the local VFW, but in regards to that mapping system, are you including like what we have in our communities as well in the surrounding armories or reserve center areas?
So right now, the map is based off of licensed clinicians that were reached out to by a couple of members of the governor's office. So if it's something where we wanted to have our inner, like DVO team, et cetera, included on the map, we would have to figure out a way to annotate that, because right now everybody on the map is licensed.
And when you say licensed, I mean, are you setting up an appointment, or is this for an emergency situation so they can speak with someone when a need arises?
These are for mental health. These are mental health professionals, like actual like centers or people who handle the mental health aspect. They do include other crisis information on that website, though.
Okay, so Jesse.
To expand that too. So when somebody say calls 988, the hope is that 988 will then use this resource map to find out where the individual is, find out what resources and licensed clinicians are in their community, and be able to send them to that clinician with the promise of being seen within 7 days by a licensed clinician. We do mention on the map the quick readiness crisis places at this point being major DAs that have first call of Chittenden County, if you will, or crisis phone numbers that can then again direct them to these clinicians.
This is more the piece where after you ask, in the military, you ask if they have a plan and all that stuff, and then you assist them to finding the care after and make sure that this is part of the Safety Now plan, and then you make sure that they have that continuous mental health follow-up.
Okay, yeah, I'd like to talk to you more further offline after this, maybe sometime.
Yeah, absolutely.
Part of the goal for the map too was to get it out to start with that part of that prevention, if you will. And then we hope to expand on the map with things such as those crisis, other county crisis places, as well as food resources, transportation, things of that nature that are military focused. So that's part of that.
Yeah, this is just one piece of a much larger puzzle that Governor's Challenge is chipping away at right now.
Very good. Thank you for taking my question.
Of course.
To Richard's point, I'm wondering if all the VFWs will receive copies of this flyer and access maps. I know the town I live in Manchester, their VFW could really benefit from this.
Absolutely, we can push it out as widely as possible. I know it's on our social media, and we're pushing out to all the units we can. So we're happy for anybody, any VFWs, VA centers, anything. It'd be awesome for us to just get it out there, and I can email it out to anybody who wants it.
Yep, and the Governor's Challenge, it's on the Vermont Department of Mental Health. It's on Center for Higher Learning page. So we have a lot of representatives on the Governor's Challenge. You can push those through all those avenues. Jesse's been wonderful at pushing it out through podcasts and this meeting.
Yeah, I think that's a great suggestion on the VFWs, American Legions and things. And I remember it's been about a year or so that we were issued all the flyers on the Governor's Challenge and how we were trying to push that out to the local areas. But, you know, if we have flyers that we can post in our local, or just some of us have our own listservs that we put out to our communities when we get something that comes up. So if you, Jesse, or you get this map out to us, we can help you share that as well.
Yeah, I can email it out to you.
Is there somebody involved in updating the map?
Yes, so actually the providers themselves can update their listings, and then there's a group email that they can actually send information to. And right now, since it's so new, it's more of a, for lack of a better word, babysat process. So there's a lot more overview at the moment just because we are looking to make sure everything is working as intended. But eventually the hope is that the providers can go in. If there's any changes, they can make those changes and make sure that if they're not taking certain cases anymore, they remove that from, so they won't come up in the filters. But it will eventually be provider-based updates.
So, so how would the providers know to go in and update it? Because I know there's a couple of mistakes on there.
Yeah.
So how do the providers?
So for the information that we have, they'll go in and be like, okay, we know how to do this service, we know how to take this insurance, stuff like that. If you notice errors, absolutely let us know so that we can bring that back. Because all the information that we have was given to us directly by the providers.
And there is one central email that providers can email into. There is one person at the governor's office right now who is kind of, as Jesse said, babysitting this map. They can email that email and they can update that accordingly.
Anybody else? Okay, bye for real.
Thank you. All right, so now what we're going to do is we're going to take a break and network internally. Those of you on the line, we will come back for 11:40. So stay tuned for some more great stuff. Thank you. Did anyone mention they can hear me?
Thumbs up.
Can't hear me?
Got a thumbs up. You're good.
Oh, testing. Welcome back. All right. Before I get on to the next presenter that I have on the agenda, I actually have this wonderful fill-in. I'm really excited that Brendan McCormick was able to join us today. And Victoria had actually done a little mini intro to say, hey, he's here. So Brendan, please come on up.
Thank you so much. Yeah, so I'm going to make this super brief because this is just off the cuff, but thank you so much for the opportunity just to share something really quick with you all. And I'm going to have the opportunity in June to actually formally present so that we talk. So Yeah, so I'm Brendan McCormick. I work for Solnet Stowe, which is a full medical detox and 28-day residential treatment facility for substance use disorder. It's primary substance use with co-occurring mental health as well. We've just increased our capacity. One of the reasons that I'm here and why I'm trying to get involved with the military community at large is because our most recent insurance contract is now that we're in network with TRICARE East. So I'm trying to connect with the military community as much as possible, just to get our name out there, let you all know that that we exist, and see how I can help in whatever way I can. I was previously the case manager at Stowe all of last year. So I know the ins and outs of how things go day to day, how things work, and would be happy to be a point of contact for anyone. I brought some information. I put some pamphlets out on the table as well as my business card, so please feel free to reach out anytime. Sauna is a 32-bed facility. As I said, we do full medical detox, and then once detox is over, it's a 28-day inpatient residential program. We do 6 hours of clinical group programming 7 days a week. You also get to meet with an individual counselor as well. You get to meet with a case manager weekly to create an aftercare plan. So because we are just a standalone inpatient facility, we're constantly needing to refer out to places like the Veterans Place or intensive outpatient programs, therapists, primary care, etc. And so it'll be really helpful once we start to have more of the military community in to continue to connect with all the other organizations for help with aftercare planning, prevention, etc. So part of my duty is just to get out into the state of Vermont, meet people, create relationships, see how we can help and how others can help us, etc. We provide transportation for anyone that needs transportation help as well. And yeah, we're continuing to expand and grow and develop more programs. And I just want to come up and briefly state what we have going on. Feel free to come up to me. I'll be here for the rest of the time, and I'll hang out afterwards. If anyone has any questions, comments, concerns, etc., feel free to come up to me and we can chat. Yeah, thank you so much.
If you all indulge me for a moment, I'm going to share a story, a true story. So I have an older brother who is a veteran. He was in the Army, he was in the Navy, he was in the Vermont National Guard. And he drank from the time he was 11 until he was 30 when he went into Maple Leaf. Maple Leaf was an organization where you could go and get services and be able to be on the road to recovery. And he's been sober for 37 years. And he was, so what they did back then, this was the mid to late 70s, parents would often just take their kids and put them into the military. The military will fix them. Well, that didn't work, But so just like everyone else, he had these issues, but he's in a much better place now. So organizations like this are so critical to the recovery, to the prevention, to the rebuilding of strong support systems. And so I just want to thank you for everything you do. So thank you. Thank you.
Very true, very important to have these resources, and super excited to hear that they take TRICARE East. Moving on right along, our next presenter, Rick Bugbee, is on. Could you spotlight him, please? And we'll put it on. And then Rick, are you able to hear us okay?
I can hear you fine, yes.
Fantastic.
So can I share my screen? Would that be okay? We'll project up. Are you going to do it? Okay, they're going to do it.
We're going to do it on this end, Rick, because we actually have multiple screens going on for this to be successful.
That works for me.
Just one moment, it should be up there for you. You can just say next slide to my wonderful Magic Man techie here, Danny.
As we get this going, let me introduce myself. My name is Rick Bugbee. I'm the VP of Programs with a nonprofit organization called Associates for Training and Development. We have an acronym A4TD. It's really wonderful to be with you all today, and thank you for allowing us to speak with you about a workforce development project that we run. Also with me is Patty Gannon. She is our Director of Programs for the state of Vermont, and sort of oversees the workforce development we're going to talk to you about today. So if you want to go to the next.
Sorry, Rick, we're just having just a quick
No
challenge.
worries. No worries. If you want to go to the next slide now, and I'll try to run through this pretty quickly because I know we're short on time, and I'll give you our contact information at the end. So if you want to follow up with us, we can. So thank you. So just a little bit about who we are. We're a 501c3 nonprofit corporation founded in 1983. And what we've been doing since 1983 is we administer workforce development projects specifically for mature workers. We are founded in Vermont. We are still in Vermont. I'm going to show you a slide in a little bit to show you where we are in Vermont. But our goal is to help mature workers either re-enter or remain in the workforce, because we feel that mature workers can add a value add to any company and can bring a lot of skills. So our goal is to make sure that the mature workers have the necessary training to be able to secure secure employment or remain in the workforce. Next slide, please. There you go. We're all familiar with our state. Just to show you, we are statewide. We offer services statewide. You'll notice we have 7 offices in the state, all the way from where I am in our St. Albans office. And you'll also see that we have offices in Burlington, St. Johnsbury, Montpelier, and 3 in the south, including Rutland, Bennington, and Brattleboro. So we are statewide. We do offer services. We're serving about 55 to 60 Vermonters right now, and I would say about 15 to 20% of them are veterans. Next slide, please. So the question is, what do we do? Right? What we do is we operate a federally funded program called the Senior Community Service Employment Program. It's a mouthful. We call it CSEP for short. And what it is, it's a transitional training program to prepare older adults who have a training need and they must have barriers to employment. And the goal of the program is to help the mature workers who are eligible to get the necessary training they need so they can secure some sort of stepping stone job, get themselves back into the community. And you'll notice on the right are the basic eligibility requirements. One must be 55 or older. One must be 125% of the poverty guidelines. So it is a program geared towards low-income people. But let me tell you, there's a lot of assets that do not count or only partially count. So what we always tell people is if you're 55 or older, you're unemployed, and you have some barriers to employment, call us and we can figure out the income piece. So for example, someone could have $1 million in the bank and it doesn't count. Social Security counts just partially. So there's a lot of ins and outs within the grant requirements that may make someone meet the income requirements when they may not. Just to give you an idea, 125% of poverty for a family of one is just over $20,000. So it's not a lot of money. But like I said, a lot of things don't count or partially count. So the Senior Community Service Employment Program has a dual purpose mission. First of all, it's to provide a community service to the nonprofit sector. As we know, the nonprofits never have enough resources to do the important work that they're doing. And the second part of the mission of the program is to transition people to employment, to prepare them for employment. It is an internship-based program. So the goal is to partner with other nonprofits around the state who are willing to host our mature workers. So our mature workers have an in-person workplace experience. And if you go to the next slide, it talks a little bit more about that. And we talk about this work-based training. Work-based training is just a fancy name in workforce development for internship, in-person training. So what we do is all of our Vermonters who are in the program are assigned to other 501c3 nonprofit to get at least 20 hours of work-based training per week to be in an internship. We're allowed to pay them minimum wage, so $14.01 right now in the state of Vermont. And what I did is I just put down on the slide a couple of the organizations, just happens to be in northwestern Vermont, but we are all over the state that we currently partner with. You'll see Ed on the right. He is mature workers that we are serving, and you can see he's got a big smile on his face. He's loving life, and we partner with Catholic Charities to help him get some training through Catholic Charities to prepare him for work. So the whole concept is paid internship for the mature workers to gain new skills, refreshing current skills with the hopes of preparing for and being able to secure employment. Next slide, please. And the main thing I want you to get out of this slide is we take a very individualized approach. We understand that all of our clients, all of our participants in the program come from all walks of life. Very diverse population, education, work experience, barriers that they have to employment. We are dealing with different people that have obviously veterans, because veterans is a priority of service for the Senior Community Service Employment Program. We're treating people that are disabled, their risk of homelessness, they have low employment prospects. Those are the people that we're trying to help to try to retrain them so they can re-enter the workforce. And we take a very individualized approach because we know that everyone comes to us with a story. It's our goal to figure out where they've been, where they want to go, and how we can help them get there. Next slide, please. And, the diagram on the right just sort of shows what the pathway will be for someone that is in our program. We start out, if we just start at the top of that diagram and work our way down that winding road, we really do take a holistic approach. Yes, we are in employment and training. That is our goal, to help train people so they can re-enter the workforce. But we're doing a lot of different things with them that we think support the employment and training that they're doing. For example, after we determine their eligibility, we're putting them through a lot of different training activities. We're getting them connected with the Vermont Department of Labor so they can work on their employment portfolios. We're introducing them to DEI training. We're introducing them to conflict resolution. We're introducing them to digital literacy training based on what their needs are. Some of our mature workers need adult basic education. We're partnering with the Vermont Adult Learning and the other adult basic educations in the state to make sure that our program participants are getting those types of training if they need them as well. We're also working on helping people get supportive services to make sure that they have the basic needs, to make sure that they have food and clothing and healthcare and transportation and wellness and whatever basic needs they may need. We have funds that can help support them to get those basic needs, or we have partners that can also contribute to those basic needs as well. And then the primary part of the program is that work-based community service training, where our program participants are actually doing an internship in person, performing work tasks for another 501c3 nonprofit. And at the same time, while they're performing those work tasks, they're getting guidance, support, assistance, learning, sort of, you talk about OJTs, on the job training. It's another way of we don't call it that, but that's really what it is as well, where they're in that workplace setting, learning skills, preparing them for work. At the same time, when they are doing their in-person internship, we're also working with them on specialized training. We're continuing to get them digital literacy training based on what their needs are. The adult basic education may continue. We're partnering with Vermont Department of Labor to help with job readiness training. But then we're also going to take a look at industry credentials as well. So for example, if someone is interested in going into the food industry, we're going to help them get their ServSafe credential, which is necessary in order to find any job within the food industry. If someone's interested in going into the direct care and healthcare, we can help them get an LNA license or a PCA license if that's something that they're interested in doing. We can help someone that's interested in retail, working in the retail sector. We can help them get the National Retail Federation training. We just put someone through recovery coach training as well. So again, there are certain types of jobs that are looking for industry credentials. And if our mature workers are interested in those types of jobs, we're going to work with them to help them get that industry credential. All of this is free, and I must say that up front. All of these are free services that we provide through the grant that we get from the United States Department of Labor. We're also working with people as they go through the program into intensive job search. They're searching for work. We're connecting with employers. We're trying to find great opportunities that match the desires and the interest of our mature workers. So hopefully we can transition them to employment. They can improve their economic self-sufficiency, quality of life, and really contribute and give back to their communities, because that's the real purpose of this program, is to help people return to the workforce. Next slide, please. We have just a couple of other activities that we do to complement the training that we give. We do something called Network to Work meetings. They are monthly participant meetings. And if we go back to the last slide, thank you, you'll see a picture on the right when it comes up of some real participants and we meet on a monthly basis. Most of our meetings are at the Vermont Department of Labor office. We oftentimes bring in guest speakers from the community that can talk about available jobs in their communities. We're actually doing something cool right now. We're doing a 2-month, last month and this month. We partnered with the M&T Bank, who is coming in and giving financial literacy training to all of our mature workers in Vermont. Anything from the basics of banking all the way to developing budgets and how to manage your money more efficiently and thoroughly. Sometimes we still have individuals that come to us that do not have bank accounts, believe it or not. So again, a part of this holistic approach that we take is to make sure that we are giving them or exposing them to all the different services that are available to them, so we can, so they're prepared for work. Next slide, please. We find that one of the, probably not surprisingly to you, one of the biggest needs that our mature workers have is improved computer skills. A lot of our participants, our mature workers, come to us. They either have technology or they don't know how to use it, or they don't have it at all. They may not have internet connection. Keep in mind that we're working with low-income people. So what we've done is, what's one of the pros of COVID, is we have developed a technology program. So what we have done is, for those that do not have technology or internet access, we are giving it to them free of charge. We have purchased Chromebooks. We can provide our mature workers Chromebooks. We have MiFi through Verizon that we can give them for their internet access. So we can give them the technology and the bandwidth if they do not have it, in order to learn from home technology training. We also partner with organizations to offer technology training. Some are virtual, some are in person. Excuse me. We're always partnering with libraries and community action agencies when there's in-person digital literacy training. We're also partnered with Technology for Tomorrow, which is a South Burlington-based company. Knowledge Wave is another South Burlington company that we are partnered with. They offer virtual live training as well. So we are really trying to expose our mature workers to make sure that they have the computer skills, the access and the computer skills, in order to compete and secure employment in an industry that they're looking to get into. Finally, with this, we really believe in the peer-to-peer model. So what we also have is, we have mature workers that have solid skills that we partner with a mature worker that maybe needs a lot of help. And we have a peer mentoring program. We do that through Google Meet. So there's video conferencing, and our mature workers who are mentors are assisting our mature workers that are mentees to helping them learn the basics of computer training. And that's been a really successful program, because it really is a mature individual helping a mature individual. So that's pretty powerful, actually. Next slide, please. And you'll see a couple successes there that were on the right. As I said earlier in our pathway, one of the things we're also doing is we're engaging with businesses throughout Vermont. We are closely in tune with other organizations as well, from Vermont Department of Labor, Hireability. We're working with Working Fields. We're working with other just businesses in general to learn what available jobs they have, what they're looking for in an employee. And then we're trying to making sure that we're providing the training so our mature workers are able to transition to that job. Again, we do it very individualized. You'll also see in the slide, there's an acronym called OJE. That's an option in our grant called On-the-Job Experience. And basically what that is, it's an incentive for an employer to hire a mature worker. And in essence, if an employer hires, excuse me, one of our mature workers, we will pay the first 160 hours of the wage. So it's a way for, we sort of defray some of the costs, because we know all employees, when they start, there's a level of training. So we help defray some of that cost, regardless of what the rate of pay is. We'll pay the first 160 hours if they hire our program participants. So that is a nice incentive that we can offer. Next page. Or I should say next slide, not next page, sorry. Some outcomes. Obviously, the primary outcome that is measurable is who leaves the program for employment. But there are a lot of other outcomes that come out of this program. The first one, if we work just left to right, is they're likely to retain employment. They're better skilled. They've been through a training program. They're motivated. They want to contribute and give back, and they have a better confidence. And that sort of goes to the second one. We know people that are working, that are performing work tasks, that are in a workplace environment. A lot of times that helps both physical and mental health, and they're being more productive. And in going to the third aspect there, they have a greater self-confidence. They feel better about themselves. When people first come to us, a lot of them have been unemployed for a long period of time for whatever reason. It's a difficult adjustment going back into the workforce. Their confidence and self-esteem is low. So getting them to be engaged in a workplace setting does a world of good for them. And it's really, it's very impactful for them. And in this program, both they're learning money that while they're in this program, that may complement their Social Security, maybe a pension that they're getting. But they're going to have greater financial independence. They're going to be learning more money. They're going to be more economically self-sufficient. Hopefully their quality of life is better. And they're going to feel better about themselves, because we all know, especially with inflation, things are costing a lot more. So that's another thing the program can prepare them for. And really what we're preparing people for is for those jobs that are $3 to $5 above minimum wage. So anywhere from that $17 to $20 an hour. Do some people get, $25, $30 an hour? Absolutely. But usually we're working with individuals who are looking to, a lot of them are just part-time. They're at a point in time when they're not looking for full-time work, although some are. They're looking for their second, third, or fourth career, that earning $17 to $20 an hour is really what they're looking for the types of jobs that they're trying to get. And if you go to the next slide, please. As I go through this really super quick, there's our contact information. I know Patty also put it in this slide for you. We feel very privileged to be able to operate a program in Vermont since 1983 that offers training services to mature workers to a lot of those disadvantaged, underserved communities. We take it very seriously. As I mentioned before, on this United States Department of Labor grant, the first priority of service, we have a priority of service of people that we need to serve. Number one is veterans and spouse of veterans. So we are very much dedicated to the veteran population and would welcome any referrals, any opportunities to get in front of veterans, because we really feel that they could be a value add to an employer and bring a lot of skills that we hope that we can help them tap into and prepare them for work through training. And with that, I'd be more than happy to take any questions if anyone has any. And feel free, you can always reach out to us separately as well.
Any questions from anyone in the room or online? Thank you so much, Rick.
No, thank you. And I did notice a couple of friendly names that are familiar names that I know we've worked with as well. So we are working with some of you already, and we would welcome the opportunity to work with more of you if it's something that you're interested in.
Fantastic. Thank you
Marcy,
so much.
this is Richard.
Yes, Richard.
This is really difficult to get your attention on this action. So we'll have to talk more about that later. In regards, Rick, hi, how are you? It's Richard down in Rutland.
How you doing, Richard?
I had an opportunity to meet with you and Danny down here. Danny does a wonderful job in our community as well. I just wondered if that income level is negotiable or waiverable, or, I mean, some of us that are getting up there in age and we decide to go back to work, we're probably going to end up making way too much in order to be able to qualify for your program. But can you comment on that at all?
Yeah, I understand, because, as you guys retire, getting the pensions and retirement and things like that, it is not negotiable. It is in the federal law. That's 125%, and it allows us that it tells us what we can and cannot count. So I wish it was, but unfortunately it's not.
Very good. Thank you for answering that.
Yeah, absolutely. And thank you for everything you're doing in the Rutland area with us.
Any other questions? All right. So,
Well, thank you for the opportunity. We really appreciate it.
oh, thank you, Rick. We appreciate you.
Thank you.
Thanks. And Patty, thank you for putting in the chat box your titles. I appreciate that.
Yes, sure. All right.
So moving right along, is Tyler on the call?
Yes, I am.
Good morning. Oh, actually, it's afternoon. Good afternoon.
Yeah, it sure is, huh?
All right, let's see if we can feature Tyler. There he is. And Tyler, do you have anything to share from your screen, or should we just?
Yes, I was going to do. I wasn't sure because he was asking to advance the slides. If I can just share the screen, that would be great.
You can
share my screen.
Yeah, you can share it from your Zoom. There should be a share button, and you should be able to take over.
Yeah, the share is disabled by the host. I just need that to be turned on.
Give us one moment.
Yeah.
And he can
Also,
he's going to make you the host because we don't have that feature, Tyler. And then when you're done, you can just, we'll grab it back.
It should be good now. Go ahead and give it a shot.
Tyler, do you see where you can claim it as a host?
it says that I'm sharing.
There we go.
There might have been a little delay. Are you?
I'm not seeing it yet.
Huh. You are screen sharing.
I can see it.
Okay, hold
Somebody
on.
can see it?
We can't see it in our space, but give us a moment. Our screen is set up share.
I can try again. It's unshared.
We can see, I can see Tyler's face, but I can't see the presentation.
There we go.
Oh, second time's a charm?
There you're right.
All right, great.
Now you need it.
There it is. Good.
Thank you.
All right. So, I guess, Stacey, do you want to give a quick introduction? And
Sure. Good afternoon, everyone. My name's Stacey Andre. I am the co-chair of the mobile home infill program that Tyler and I have been working on over the last year. It's a collaborative effort between the state of Vermont and the Vermont State Housing Authority to quickly and affordably put housing throughout the state of Vermont. We're concentrating right now on manufactured home communities and really have been working hard to provide quality, efficient homes all throughout the state. And Tyler is going to show where we have some homes available right now, and we're building and getting them in so that we can get some affordable housing where we most need it. As you all know, the housing market is tough. And it's even tougher when you look at the price and of what you're getting. And so the governor put this initiative together to be able to put some homes out there that people can be qualified and eligible for, and get it going. So Tyler, I'll pass it to you.
hello, my name is Tyler Moss. I'm the Director of Program and Housing Development here at Vermont State Housing Authority. So this rapid response mobile home infill program is a long name. We call it MIP, or just the mobile home infill program. The program was started as a response to the flooding in 2023 and 2024 to provide quick access to home ownership, especially for those who are displaced and in mobile home parks or elsewhere. But the program is open to everyone, not just flood victims. We currently have placed over 30 mobile homes around the state, and we will have 100, at least 100, by the end of 2025. The eligibility criteria for this is really basic. We have that you need to either live or work in Vermont. If you are living outside Vermont and you work here, the new home would have to be your primary residence. Or if you live in Vermont, it would also have to be your primary residence. But these are no second homes or rental opportunities. These are homes that people will be living in. Up to 140% of AMI. So that's a high threshold.
Can you explain that a little bit, Tyler? I know that's just a number thrown out there, but what's that mean?
Sure. So the 140% of AMI is the area median income. Right now, say for a family of two, you're looking at about $120,000 in income. So two people making about $60,000 would be eligible for the program. That goes up a little bit, per person in the home. It's almost up to 140, I believe, for a household of three. Mm-hmm. So that will also change when HUD raises those in April. So that's on our website to get more details. These homes are all for purchase. They are only for sale. They are not for rent. They are not available for rent to own. They have to be purchased and lived in as a primary residence, which would mean typically getting a mortgage through a first mortgage loan through a financial institution. However, there are other options available we can talk about, but the homes are also only in mobile home communities or mobile home parks throughout the state. They cannot be purchased and placed on privately owned land. They are purchased as they are, where they are in a park. Although there are a variety of options between the 2 bedrooms and 3 bedrooms and bathrooms and styles, you're buying what you see and not customizing it for an individual. The home's prices range between $90,000 and $110,000. So we're looking right in that $100,000 range. The prices are non-negotiable. It's a fixed price, whether you're in Burlington or other lower market rate areas. The prices are the same across the board, and they're locked in. So there's no bidding that's done, which is good. Okay, it takes that out of it. It is first come, first serve for people who put a deposit on a home. The homes are all brand new. They're in turnkey condition, ready to go. They are at a minimum Energy Star, but the majority of the homes are actually zero energy ready homes. So they meet a higher standard than even Energy Star for efficiency, and also can be retrofitted with heat pumps and other modern electric amenities. There is some some down payment assistance available through the Champlain Housing Trust. That's a limited number, and that only goes up to 120% of AMI. So that is a huge part, getting that down payment, because this is you still do need to come up with that for the banks. This is what the homes are looking like. Some parks that you might be familiar with. We have gone in and put in some brand new homes that look a lot more like this. Sorry, I like doing the back and forth, the before and after, because I'm amazed by it myself. Here's some of the areas where the homes are located. However, we will have this map updated in the next couple weeks, and we will be adding multiple counties where Rutland will be added, Rutland County, Addison County, Lamoille County, and so on. Franklin County.
That's right. And that number will increase. Right now we have 30 homes that are on the market that just came up, and we have just put on the market on our website and through a real estate agent. And then we'll be working on another 30 that will be coming online in the next few months. So we'll be having that coming soon. So if you don't see something here right now, it's well worth coming back and checking our website. And as you're looking in the realtor.com and you're looking in those areas, you'll now be able to find our listings. Tyler, could you jump to, oh, perfect. Okay.
Question.
So like I was
really
saying,
quick. Yeah. On what these look like. They're lovely homes. They have pressure treated decks, and all of them look a little bit different and all have unique features. But this generally is the quality and the fit and finish that we strive for. Most of these have this style of craftsman style with some modern amenities, insulated skirting, thank you, that have, I don't know, it works by magic, but based on the weather and the temperature will open vents and close vents so it stays dry underneath the house. Really great quality homes. We're really excited about bringing these forward. Tyler, could you show some of the insides?
That's what I'm doing. These, yeah. So the bedrooms and such here, you can see it's fairly standard. The living space, though.
Yeah, that one's great.
As you can see, is very modern. These, with hoods over the ranges. There's USB outlets. Ports on the outlets. They've got refrigerators with your water and ice maker hooked in. And this is just one style of home, right? This is one of the 2-bedroom homes. So they all do vary. You can see they have a lot of windows, great natural light. These islands, this is actually a tuck under, so you can put stools under, so you can have an eat-in kitchen style. Your hot water heater and furnace are here for easy access and maintenance. You can see right here in the bottom, like the outlets with the USB and USB-C ports. So just basic, some real nice homes all around.
And they all do come with brand new washers and dryers, so they will be completely move-in ready. And so we're really excited to bring these forward. And it's exciting. I think the park owners are also excited. It's really changing the feel of the park, and really getting in line with today's standards. They don't make them like they used to. And so it's really exciting to
in a good way.
Offer these. Yeah. Not like they used to. So it's really nice. And this one right here in Springfield is listed at $92,900. So
that is
market
the
rate.
Final. That's the turnkey price. People should know that there will be, there's closing costs associated with these homes. So, that would add something to it. But you'd be able to get into this home for less than $100,000. So,
We have a question.
Okay.
I was just gonna say that if you could explain what a turnkey.
Turnkey. That means that it's not a fixer-upper. That means that everything in the house is brand new. So when you close on the home, you will get 4 keys, and you will put the key in the door and open it up, and you'll be the first person using the home. None of these homes have been lived in. So nothing needs to be done. They have a minimum, they have a 1-year warranty from the manufacturer and on the installation. There are extended warranties on some of the appliances. Again, these are all Energy Star and fairly modern appliances. I was wondering if there was a picture of the washer and dryer in this, but I guess not in these photos, but there are in some other ones.
Yeah, it's a great question. When we first put this program together, we wanted to make sure that people could move in right away. A lot of these homes they don't come with any appliances or washers and dryers or even these upgraded steps. And we wanted to make it so that everything was included and you didn't have to go and purchase those kinds of things. And we wanted to make sure that there was a warranty that went along with the home to really just take the ease and pressure off of the new home buyer so that they felt like they could just turn the key and walk in and move in their furniture and go forward. So we're really excited about it. Great question.
We have another question.
Yeah.
So, as most military families know, most of the VA loans and other military incentive loans will not fund loans for mobile homes. I see that you're working with Champlain Housing Trust. Do you have any other SMBF funding sources or resources that you're working with for help with these homes necessary?
Yes, so we've been in contact with multiple financial institutions who will lend in this, and we have that listed on our website, and that's like East Rise as partners. They've actually given us a special loan rate for people in this program. So it's actually 1% below. So if people will go with East Rise, it would be below their normal market rate. And then also, Green Mountain Credit Union, Vermont Federal Credit Union. We've had Mascoma has gotten involved, Members First, Heritage. So a lot of institutions, and we keep adding more every day.
Yeah, I just got a call from 802 Credit Union that wants to be involved, and so we're definitely
they're calling. They're calling us to
out.
get involved at this point. So
they're pretty excited. I think they received a call for one of these homes, and so now they want to get involved in the program. They realize that this is something that will help the communities, and credit unions seem to be in a little bit better position to be more flexible with lending to homes in manufactured communities. So they have really stepped up. So we've got 6 or 7 options right now. You're not required to go to those lenders. Those are just recommendations. So if you have your own, maybe you have something through USAA, and they're offering you something, you're perfectly welcome to use your own lender. This is just a recommended list. It's not required.
Also, the USDA will, as we've discussed with them, so people who are lower income who may have trouble getting financing through a traditional lending institution should contact the USDA. That is on our website as well. So yeah, that's another option, or the VA loan.
Question.
Is this a portfolio program or is it sold on the secondary market?
The banks are mostly doing the portfolio loan. They don't go through U.S. Bank or Fannie Mae, Freddie Mac. Most of them are doing them in-house.
Thank you. Are there any other questions? All right.
I'll just
thank you so much.
Yeah, I'm gonna drop my contact information into the chat there in case you need it. It was at the end of the slide, but makes it easier than writing it down sometimes.
Yep.
But I know we're coming back in June. We'll have a lot more slides and an update on the program. So we look forward to seeing you then. Thank you.
Thank you. A lot of great information.
Yeah, thank you.
All right. We're almost at the tail end of our presentation. I'd love to open the floor for any announcements or final comments from anybody in the room. Yes.
Hi, I'm Karen Boyce, the former managing director of the Veterans Place here in Northfield. For those of you that aren't familiar, we are a VA-funded grant per diem program that helps unhoused veterans. So we've been there, we're going on 16 years right now. I brought our new managing director with me today to introduce her to the group because I've been coming for this for several years now, Miriam. So I wanted her to start networking with all of you. And to let you know, we do have 2 positions open. We have a case manager position and a housing case manager position, which I'm filling right now, even as retired. So if any of you know of somebody who is interested in a new position, working with veterans and helping them get back on their feet and getting them housed, we put some information with Bonnie's card out on the table there. So grab it. Yes, Mary.
Can you send us information on those positions? We can help advertise it.
Absolutely. I'll have Bonnie do that. I'll share your email with Miriam so she can get that out there. So thank you very much.
Thank you. Anyone else? How about anyone on the call? Is there anyone that would like to share or announce anything? All right. Our next meeting is on Wednesday, June 11th, and the topic's going to be comprehensive support systems, which is a very broad topic, but we want to encourage anyone that may have a resource or presentation to talk about the network of resources and programs that are in support of the military community, whether they're veterans that are no longer serving or those that are currently serving our family members, regardless of range or component. So we'll see you all in June. Thank you.